Hi, it's Dr. Brian McKay of Core Health in Darien, and today I would like to talk to you about the effectiveness of laser for back pain, specifically cold laser for back pain, class 4 cold lasers, low level laser therapy, LLT. And the big term we're now using these days is called photobiomodulation. Photobiomodulation. And when I say that, I want you to think about how sunlight affects a plant and how that really makes okay, the plant uses light to induce photosynthesis to grow. Well, the tissue in the body does the exact same thing. Laser, I guess what happens is, you know, I'll give you the official term for photobiomodulation. Therapy is defined as the utilization of non-ionizing electromagnetic energy to trigger photochemical changes within cellular structures that are receptive to photons. Mitochondria is particularly receptive to this process. Now, why is that important for pain? Mitochondria are the boilers, the powerhouses for the cells. And anytime a cell is damaged, like say you have a muscle damage or nerve damage, the mitochondria need to fire up to repair. And when they're not able to, because of the injury or the trauma or the chronic nature of an issue, that the cell's not working efficiently. And the laser or the photobiomodulation allows for the cell to start upticking and producing more energy. So it's kind of like getting that boiler cleaned out and having it run more effectively. And it's basically like a non-invasive light source that it doesn't emit heat, sound, but it's what it's doing is it's using photovoltaic, light sources to generate a significant amount of energy in the cell. So that's really where it's important. But people often ask, does laser therapy work for back pain? Many studies show the benefits of providing pain relief and improving disability in the low back patients compared to not using it. So in that sense, yes, it really does. It does work. And here's how. Light. Okay, lasers improve circulation. They support cellular health through the increased production. It forces the mitochondria to produce more ATP, which is the energy source for the cell, and it releases endorphins that fight pain. It reduces inflammation, and it encourages the growth of new healthy tissue. So while it's not something that you're going to see because the drug companies really can't profit from it. So what does that mean for you? Well, you're going to have to search it out on your own. We've been using laser now here at Core Health for approximately 6 years. And what it does is it really allows someone to get better quicker. That's basically what I feel. In addition to the chiropractic care, or if we're doing spinal decompression, these things really make a difference in how someone feels. So it's used. A lot of times this stuff comes from Europe because their healthcare system is different. They actually have a much lower cost of operating. So we even use it on herniated discs. That's a fantastic thing. When a herniated disc and that pain is in there, you have damaged tissue, and by increasing the energy production within the cell, you're allowed to cycle out of it a lot quicker. There really are, there's as far as side effects, you may have a little bit of redness, changes in skin color, so you really just do it, and you have to wear certain glasses to protect the eyes, because typically we're doing it on, say, a bad elbow for a tennis elbow. We're using it for a number of different things, but typically you have to protect the eyes. That's the key thing when you're doing a session of cold laser therapy. Um, you know, the, Also, to get a little more scientific with you, is the laser decreases the nerve sensitivity by decreasing a substance called bradykinin, and it's a pain eliciting chemical. So when the body recognizes there's something wrong, there's an increased production of bradykinin, and the laser then kind of normalizes the ion channels, which is, so I want you to think about a cell membrane as a balloon, and the ion channels are across the surface of the balloon, and it lets stuff in and it lets stuff out. using sodium or potassium in and out of the cell to accomplish what it needs to accomplish. And so what the laser will do is it'll normalize the channel, the surface of the membrane, the cell membrane itself. And again, think of a balloon as the membrane inside the cell outside, but that membrane is the balloon surface. And by making that more efficient, we bring about healing a little bit quicker. So when when these ion channels are working properly across the cell membrane, it releases endorphins and and enkephalins that have an analgesic effect, which is a pain reducing effect. So you can see from a scientific standpoint that it's a pretty darn good way of mitigating someone's pain. I mean, we have many different ways to address pain, but this is a really important one. So we have, like, lasers, arthritis, you know, that's an important one because arthritis is typically going to affect older people. I'm talking about degenerative osteoarthritis, and movement is limited. There's been studies showing with patients with rheumatoid arthritis, which is that's a immunocompromised type of arthritis. These people have a serious decrease in pain with using it. So what happens is it gets you to be more flexible. That stiffness goes away. So it's really a fantastic way to adjunctive. It takes about 5 to 6 minutes to apply a laser treatment. So, another question I get all the time is laser effective for sciatica? It's definitely effective for, discs, but sciatica is a little bit different than a disc. It's a really solid way and it's not invasive. So if you've got like chronic sciatica and we start mobilizing the pelvis, so we take pressure off that nerve, the sciatic nerve, which is a big nerve. The sciatic nerve is approximately the size of your thumb. That's a big nerve. When you lean on that nerve, it's going to cause a lot of pain. So the laser takes this concentrated energy and it focuses on the soft tissue in your body at the cellular level. So there's tremendous benefits when, as far as pain relief. Some people, people use it for weight loss, other stuff. We're using it for pain specifically. And, we also use it for knee pain. It helps alleviate pain, and it's a wonderful way for you to get feeling back again, because when you have pain, you move less, which increases the problem because now you're not producing enough synovial fluid as this relates to the knee. So it's really, really important. Now, the one thing is a question we get all the time is laser covered by insurance? Insurance companies do not cover laser therapy. But it's relatively affordable. As veterinarians are doing it for the pets, so it's a very non-invasive way to make a significant difference in the person's level of pain. Like I said, we've been using laser here for years, and it has been a fantastic way to eliminate pain in addition to the other things that we do here at Core Health. Now, if you have any questions about a condition, or if you think that if laser therapy could help you, by all means, give us a call. Or come in for a free consultation. We'll talk to you about it. There's no harm because, quite honestly, we can't help everybody. But during a consultation, we can determine if we can. If we can't help you, who's the best doctor to get you to? So it's a good approach. It's a good tool to use when someone's in pain. And so I invite you to give me a call. My number is 203 656 3636. 203 656 36. I'm Dr. Brian McKay, Core Health in Darien. I look forward to helping you. And if you have any questions, feel free to give us a call. Thanks very much.